Welcome everybody to this show called Call the Doctor, where you're invited to call into the number which we'll give below in a few minutes. Today we're going to be talking with our very illustrious guest, Mr. Bill Hill, who for 43 years has worked for the Health and Human Services Department as its director. Today we're going to focus on a lot of things that department services and where he's dedicated his life to. But we're going to start off talking about COVID, correct?
Yeah.
This is Gene Kitchen, my illustrious co-host.
We're illustrious. You like that, Matt?
Yeah, we're both illustrious. And first we're going to talk about COVID at first, because that's really the preeminent healthcare phenomenon that's going on in our society right now. And let me throw some numbers at you. I'm going to read some of these so I get them right, because the numbers change consistently, and patients sometimes very incorrectly interpret that as the CDC not knowing what they're talking about, or my doctor told me this one week and he told me this another week, and that Fauci doesn't know what he's doing because before you only needed 2 vaccines, now it's 3. And as the disease changes, as the environment of this ever-evolving disease process changes, so does the advice. So let's give you some up-to-date statistics as a segue into your teaching us what's going on.
And I'll do that at the local level. You're going to do it at the national level.
I am going to do it at the national level. First of all, at the national level, just yesterday, there was at least 1 million new diagnoses in our country. 1 million. And that's only people who were tested in certified testing facilities. Those who were tested at home, which may be another 15 or 30% more that tested positive, are not included in that. So it could be 1.5 million. And an outstanding number for a pandemic. And so the disease is spreading, and it's spreading rapidly. Unfortunately, this Omicron variant is not as deadly as the Delta virus. It's more infectious, meaning it's more likely to spread from one unvaccinated person. She is vaccinated.
And boosted.
And well, that's what fully vaccinated means this day. You need all 3 to be considered fully vaccinated. It spreads from one person to another one much more aggressively, right? And that's important to understand. Just a couple of weeks ago, we had 14 admissions to the hospital. The week after that, 25, and last week, I believe it was 34. So it is.
And today, 52.
And today, 52.
52 inpatients at UNC National.
Twice what it was just 2 weeks ago. Right? Unfortunately, we've had no deaths, and that's a statement of the phenomenal.
Recently, no deaths. I mean,
well, we've had deaths. We've had 250, roughly 250 deaths again that we know of. There have been deaths in nursing homes, which typically run about 16% per year, but all of a sudden it drops up to 36% in 2020, and because those people never had a swab put up their nose when they died, we're presuming that they weren't COVID deaths, when probably they were, So we're not counting all our deaths like they do in a lot of European countries. Getting back to my point, though, there are no deaths recently, thanks for pointing it out, with the Omicron variant, at least in our hospital. Obviously, there's deaths elsewhere, and that's just a testament to the absolutely phenomenal care that our ICU does. Dr. Desai and his team, our emergency room team under relatively new management, do an absolutely outstanding job. And you have to be part of the outstanding job that they can deliver. The best thing that you can do if you need your testing is don't go to the ER. They're overwhelmed. You can imagine how hard they work to begin with. They still have to deal with the heart attacks and the traumas, and they keep Dr. Hasty, our phenomenal trauma surgeon, busy all the time, orthopedic trauma surgeon. And for them to get those patients in and processed like they would without the virus being part of the problem, we need patients who are concerned about their testing status not to come to the ER for their testing. Instead, at the bottom on the screen, you'll see an email which is a testing locator. go to that website, not an email, but a website. Go to that website and it'll tell you which ones are open and closest to you that can provide that testing service.
For example, tomorrow in
Right.
Nashville behind the Ag Center, we'll be there from 10 till 2.
Right.
You have to have appointments to come.
We'll assure you if you come without an appointment, you'll be tested, but that is something we're doing in our call center. And this is a PCR test that's being run, the lab part over at the hospital.
Explain what a PCR test is.
That's the molecular test, and that's the gold standard test, as
Right.
you know. We do rapid antigen tests, and they're the 15-minute turnarounds, but the PCRs are typically what we do and send to the state lab, state
Right.
public health lab. Typically, there's a 48-hour turnaround with that. However, I'd like to plug the hospital and Dr. Lee Isley for donating a number of, and thank you for being on that board and being a part of that. We got 400 test kits Friday, and we had our first environment coordinated that with the hospital yesterday. We tested 98 behind the health department, never had to get out of the car, just like we do vaccinations. And a number of those were positives. The good thing about this, not only was it a gold standard PCR molecular test, it wasn't a rapid test where you get some false negatives, but these test turnaround results, since the cultures were taken to the hospital, were in 6 hours instead of 48 hours.
Great.
So people knew last night. As a matter of fact, unfortunately, I had to call some that received positive results, but most of my calls were negative results.
And I think a good takeaway message here is that some of the rapid tests may give a false negative, meaning you can have the disease and it be told that you don't, and it may give a false positive where it says that you have the disease when you really don't. So the more accurate testing at times is indicated, and that's the test that he was just talking
The
about.
PCR. A lot of times with the rapid test, when it says positive, it's pretty close, pretty dead on them. But with the negatives you do, it's just not quite as sensitive in the nasal passage to the culture. It's just not as sensitive. And you know, a key part, doing these 5 days after exposure, not too soon after exposure. Need a little incubation time to get a good culture.
Absolutely
I'm
true.
hearing that one reason we're really running out of these kits is that people are just panicking. I've never had a test. I've never had any reason to think I needed it. But people who, such as I, go get them just to make sure. Please tell us who needs to be tested and who does not. What would be a trigger?
I think one of the things you obviously look for is what kind of exposure have you had. Do you know that you've had an exposure to a positive case? And that's one that you certainly watch symptoms. And the next thing you have to ask yourself, if you've had an exposure, have you been fully vaccinated, as the doctor said, meaning also with booster. That goes into isolation and quarantine, and I could talk about that just a little bit, the difference in those terms, even though they're used so many times interchangeably. Isolation, means you're ill. Quarantine means you've been exposed to the virus. But back to your question, which was?
How do people know if they should be tested? Like,
Okay.
I'm not going to go be tested because I have no symptoms. I guess if I were around somebody, you're saying I might want to consider being tested?
I think if you were in a typical call I would get would be a daughter has come home positive. She lives in the household with the parents, and they've been around, and she just tested positive yesterday. I think they obviously need to look at their vaccination status again, look at whether they develop symptoms, and we all know that you can be asymptomatic, especially with Omicron.
So they would wait a few days?
Wait 5 days at least,
Okay.
and test and get a negative and feel good about it.
Okay.
One of the valuable
But
things...
protect yourself from infecting other people in case you are contaminated.
Exactly.
Right?
Wear a mask, stay quarantined. One of the new CDC guidelines on this, though, if you're fully vaccinated, and I won't keep saying and boosted, but fully vaccinated, if you've been in contact with a positive case, you do not have to stay at home, but you do need to wear a mask when you go back to work, monitor your symptoms, see if you do it, and it'd be great to test at 5 days to see if you can get
At
that
5 days.
confirmation that you're negative.
Okay, I just want people who need the test to have them, not just general people who are panicking all the time wanting to know what their status is.
Yeah, there are a
that makes
number of
sense.
people that have had multiple tests because of any kind of symptom that
Panic.
might come along. And I think, again, the exposure all of these symptoms, these telltale symptoms that we talk about, whether it's fever, even headaches, even lower GI with some of these issues, but the sore throat, the congestion, and you would hope at this early stage it wouldn't go into lower respiratory issues at that point. And we haven't seen that with this strain as much. As you were talking about, the acuity of this particular virus has not been as extreme as with what we experienced with
More
Delta.
flu-like, headaches and upper respiratory.
Highly transmissible, but just not the severity that we saw with Delta.
Most places I go, I'm horrified personally because I wear the mask. I started out wearing it just out of respect for people who would be upset if I didn't have it on, but now I'm wearing the KN95. But our community, Bill, is not wearing masks like I feel like they should. Can you address that?
Well, you know, we go back to the 3 Ws and the ancestral strains that we had from the very beginning back in March 2020. And that's the only thing we had. We didn't have the vaccination. We were waiting for them. We didn't
2019,
Yeah. And then, of course, March of 2020, we really started feeling it. And then last year, we got the vaccination. Right along this time, we were just getting cranked up, right after Christmas, but right now, we're getting cranked up with vaccination clinics. But I think the masks are still extremely important the 3 Ws. Stay at a distance. I know we're not, but we've tested ourselves, and we feel like we're in good shape. But I think typically the distance factor, the washing hands, so important, and the mask and the right kind of fitting mask is important.
And you want to mention what you mean by right kind of fitting mask?
Well, I think, you know, you alluded to the K95 or the N95, and that's certainly one that does fit, and it's a tighter fit than something like this that is more useful than not having it, but is certainly not as good as the N95. But one that...
And then, let me interrupt, to take that further, a bandana around your face is worthless completely.
I think some masks simply are like that. The bandana is just for show.
Yes.
It's only for show. It's not doing much to prevent.
And this is the KN95, which it's got, this one's 6 layers. Most of them are 5 layers.
Yeah.
And I've heard that they're not as good as the N95, but I can breathe really well in this. It fits really easily. I got it on Amazon. And I've been told that this is a little bit better than the ones that are just 3-ply.
I would certainly think
a better fitting KN95 is better than a poorly fitting N95. A KN95 mask is actually one typically and has always been manufactured in China. The Asian market has worn masks for decades longer than we have, just for regular airplane flight. To prevent the common flu for transmission, and so it is a much better fitting mask, and we provide them to every single patient who enters to my office because we often get worthless mask usage. And if I'm going to be in a small room with somebody and 40% of the people in a room with me are not vaccinated, I'm going to
40%?
Yes,
Wow.
I'm going to give you a KN95 to wear. It's worth the expense of that mask to help protect me. Although I'm fully vaccinated, I'm not fully protected from getting that virus, remaining asymptomatic and transmitting it to somebody else. I could still carry it. So.
And we saw that with flu last season. Guess what? With the mask and using and practicing the 3 Ws, we probably had a non-existent flu season or very, very low prevalence.
Because the mask helped prevent it.
Yeah.
And colds too. I hadn't had a cold, and I can't remember last time I had a cold.
Me too.
Yeah.
So I think it is highly effective and something we still should stay cognizant of and use the mask when possible. And that's when you go out or around people.
Question from a viewer that didn't want to be on the air.
Okay.
They want to ask the health director. They said everyone is going to have a date with Omicron. Do you believe that?
Everybody's going to have a date. That means everybody's going to catch it.
Yes.
Let's talk about that a little bit. We've had a vertical surge of coronavirus. Let's talk about the numbers just a minute. Just short term. Well, let me go back a little longer term. I thought with Delta, when we had 490 new cases in a week, that was mid-September. It was actually September 14th, had 490 cases. I said, wow,
That's in Nash County.
Just in Nash County, thank you. And it did go down steadily after that. But then we started seeing this Omicron come along. We started reading about it, hearing about it. We knew from Africa it was coming our way. In Europe, we knew we were going to have it upon us. And 2 weeks ago, we had 137 new cases. Last week, we had 1,425 new cases.
Wow.
Today, I reported 4,242 new cases. So we're 1,000 cases more of new cases, more than even last week with the 1,425. Back to your question again, do we have a date with Omicron? Well, maybe, maybe not. Maybe this is going to be our way out. Maybe this is going to be the natural immunity that takes the pandemic to a lower level. I think we'll get another strain. I think we'll get another mutation. Will it be worse or maybe milder? We'll see.
Or worse, yeah. It could be very much worse.
It could
I've heard
be.
there is a new one that's been
Yeah.
discovered.
Yeah. But whether this helps us get to the natural immunity and the herd immunity that we've talked about for a long time, we'll see. Will everybody have a date with COVID? I doubt everyone will, but it certainly seems like right now with this vertical surge we're having, it is highly transmissible.
Yeah, and I might even argue with you with full respect on that. When 1 million people in one day get diagnosed, and that's a conservative estimate,
Yeah.
I tell my patients that you will get COVID. Statistically, you are going to be a victim of it. The issue is whether you're vaccinated or not.
That's right.
And that's really going to be the response. Because chances are, if you don't want the vaccine, you're probably not a compliant mask wearer. And the combination of a non-compliant mask wearer and an unvaccinated, and I mean fully vaccinated, which means 3 vaccines if you have one of the messenger RNA ones, which would be, to use common language, not the Johnson & Johnson, either the Moderna or the Pfizer vaccine. If you're not fully vaccinated with the booster and you get COVID, your chances of dying are significant. Real numbers, if I could read again for this. An unvaccinated American, and this is from yesterday's CDC, an unvaccinated American is 20 times, that's 20 times, more likely to die from a COVID-related complication than a fully vaccinated person.
The monoclonal antibody infusion is in very short supply now. And it's my understanding that they're having to really prioritize people 70 and older who are unvaccinated, or people who are at extreme health risks, like older than that even, are the only ones can get it, because we can't get enough of it. For a while, the hospital had plenty of it.
Yeah, and 2 of these strains of that particular infusion therapy are not very effective with
Right.
Omicron. It's one, and that happens to be the rare one,
Yeah.
the one that's so scarce.
Uh-huh.
Antibody infusion goes back a long ways. It must
Yeah.
go back 75 to 100 years.
Yes,
It's
it's
an
been done a
old,
long time.
old method.
Yeah. Let's talk a little bit about variants and how they develop. The Delta variant, I believe, grew out of India. The Omicron variant grew out of South Africa. And where this comes from, or when you have large populations of unvaccinated people, where a virus sees an opportunity to spread, and it knows what antibodies are in the area, meaning what resistance people have to fight it, and they do an end run around it. It's not much different than a defensive football coach telling his team to change how they play the game to get around a new offense. And then it becomes, because there's less resistance to it, it becomes a dominant strain. If it becomes more infectious than the one before, more aggressive, it becomes the dominant strain. It will supplant the one that was there before. We used to have Delta variant. This one is more infectious, so it's rare to find a Delta infection now.
It does have without neurons, without a brain, it is an amazing, and how long a virus has been around, millions of years, and they survive, and it's got to have a host, so it's looking constantly for that host and to fool that spike protein, if you will, to try to infect that person. And often it has to do like that football. You got to throw a few curveballs if it's baseball, but you have to make a few different moves to get that person infected. And I think so many times with these mutations, they are highly effective with mutating enough to, again, make this transmission of the virus possible in the host.
And the vaccination has been proven, even though it was developed on the Alpha variant, the very first one, it has been proven thus far to be very effective in protecting people even with subsequent variants. It's still a wonderful shield.
We looked at it the other day and talking about natural immunity. You know, I always used to think natural immunity was much better than a vaccine-induced type of immunity, but everything I've read on this one, I think the vaccine immunity does beat out the natural immunity. It looked like some of this indications early on was you might get a 20, 21, 25% natural immunity protection, immunity from...
That meaning if you got exposed to the virus, whether you were hospitalized or not, your body makes some self-protection.
That's that natural way.
That's the natural immunity, but it's not a long-lasting immunity for the next variant, is what you're saying.
Right, and if you have 2 shots, you might get up to 30-35% protection. But here's the booster effect. With the booster, it jumps to 80-85% protection. So I mean,
that's lasting as well.
Yeah, lasting, and you get so much more benefit than just the 2 shots. The booster is really the name of this game with Omicron.
Right.
And we need to take a quick break, and we'll be right back, okay?
We'll see you on the other side.
Well, the community paramedic program is a program that sends paramedics out into the community to help patients after discharge.
It connects the dots for them. He provides education and also to proactively take care of our patients. So evidence-based practice says that if the community paramedic sees the patient in the home, they're able to decrease the readmission rate. It just decreases the burden on the healthcare system.
Taking chronic patients, it takes a toll on all the providers, from the ED to med-surg, nursing, to the dispatch call takers. Some of the things that we do when we go out to residents is we will do vital signs, we will do medication reconciliation, where we take and look through all their medications. We answer phone calls. If patients have questions, we can help walk them through their needs. We can communicate with their doctors. Sometimes they'll make medication changes right over the phone, and that'll help keep a patient out of the hospital so they can be, at home and healthy. We do lab draws for patients who can't get in and out of the house. We do coronavirus vaccines. We've seen patients who were our high-risk readmitters who had been in and out of the hospital get their diseases under control. Most of the time they get a better understanding of their disease process, and they're able to live a healthier life, which is what we want ultimately, is for the patient to be healthier.
Well, after he gets to the routine, he answers all my questions. And he takes the time. I mean, those heart doctors, they whiz in. They're so rushed. And you go, and they're gone. But Till takes the time.
I'm so lucky to have Mr. Till in my life, because if it weren't for him to come back and check on me and make sure that that I'm stable and able to go to my doctors and see what kind of meds I need, I won't have nothing.
He's a blessing. He really is.
So being able to connect with patients on a personal level and just talk to them and let them know that it's going to be okay, and that you can be healthier, you can resume a good quality of life. I think that helps the community as a whole.
This is where the public would benefit if they had more Tills out there.
Honestly, I would really like to have at least 10 community paramedics to be able to cover our patients.
The more cars you have, the more people you can help, the more lives you'll save.
Welcome back to the second of our 3 segments of today's show. We're presenting Dr. Bill Hill, who's head of the Nash County Human Services Department. He's its director and has been for 43 years.
When he has a new, he was elevated beyond health director, which he's been forever. You were health and human services.
I do have a dual role.
Right.
And that was when we consolidated about 5 years ago. And social services, veteran services, and the health department became under one. So I became human services director, but kept the title as health director also.
And you probably didn't make any more money. They just gave you more stuff to do, right?
Probably make more money as a consultant if he would retire. In fact, I understand on the slide that he's delayed his retirement very ethically, holding the reins of this till COVID is over. So everybody applaud this fine heart over to my left.
Well, thank you, sir.
I get asked a lot in my office to help me understand why my previous COVID infection does not protect me. And you alluded a little bit to that when you said that we just don't have as much natural immunity as jumping up to the plate and really serving our needs. And I tell patients, well, because we have a hunting community, and I say, well, picture that first vaccinations you have as a 22 bullet coming at you, and now you've bought yourself a 22 vest of self-protection. Mm-hmm. But now there's a 45 bullet going around there.
Yeah.
And then the next variant that comes out of another area that was never served well with vaccinations. The next variant may be as infective as the Omicron and as deadly as the Delta in combination. And that 22 vest isn't going to help you at all when there's a 45 bullet, 9mm bullets being shot at you. It's going to go through both ends of your vest, and you're very much a victim. So please understand that having the infection does not protect you at all. In fact, it suggests that you might even be at more risk because your immune system was compromised enough in the first place for you to get infected, or your lifestyle, your behaviors, or your refusal to get vaccinated. There's something about you that makes you at risk. The people you hang out with, you don't socially distance. You were tagged once and you're just as likely to be tagged again. Tell us the differences between an endemic and a pandemic.
Or even epidemic.
Sure.
Yeah. Well, let's talk about pandemic. That's a global kind of thing that usually involves the World Health Organization, WHO, that declares a pandemic when it's a world. It's not just in the United States. It's not just a localized outbreak. It's an infection that is going on all over the world at the same time.
And in fact, that's what the word pan means, like in panorama on a photograph.
An endemic is more of a natural environment where you see a disease like coronavirus has been in bad colds for quite some time, but we've lived with it.
Right.
Malaria has been in a lot of Latin American countries and Africa and different places where people have learned to live with malaria, with protection from mosquitoes, especially that Culex mosquito. And you used to say you don't have to worry about it except the female mosquito, because the female mosquito is the only one that bites and needs blood for the eggs. But who can distinguish between a male and a female mosquito?
Yeah.
But you have to be concerned about living in a world that we hope to get to shortly, or at least in the next year, where it's endemic. We still have coronavirus, but we're living a more natural life than what we're living in a pandemic that's still sprouting out mutations and still coming out with different forms of the virus and the strains that we call. And we will see some more strains come from this.
Oh, we definitely will see that. And we just have to pray that they're not aggressive strains, or that the people of our society will accept vaccination. I have 2 scars on my arm, and those scars were made for me to get into first grade and into high school. And I got those scars for smallpox because when they injected my arm, they literally stabbed it 36 times in the circle of a Roosevelt dime size. So I have a permanent scar, which is my vaccination record.
Yeah.
They could have injected it in my muscle, just like this vaccine, but I needed a physical vaccination record, proof that I had that, and that's why smallpox has been eradicated from the world. And when that vaccination was up, there was just as many people protesting that it was the mark of Satan, like some evangelical ministers are claiming inappropriately, or that it's a political reason, the government's forcing it upon us. And that existed back then. However, it was mandated back then, which is the only reason why that disease doesn't exist anymore. So,
A good point. And you know, during 9/11, we started vaccinating a few of our nurses again with smallpox. Nobody knew how to use the vaccination method that you have to use, which is a scratch-type vaccination. But we did revaccinate because we found out the immunity was not still there. And we needed some health care providers that could protect the public. Now, we've often heard, and we're getting off the subject a little bit, there are 2 strains of smallpox still in the arsenal in the Soviet Union and the United States. They could be used for bioterrorism, and that's been a concern. But being eradicated is a major thing.
Hey, you know,
The breakthroughs I also wanted to talk with,
Okay.
just a little bit with the breakthrough. You know, that's one of the defenses that I hear occasionally, that people, I'm not going to get the shots, or because I know neighbors, know friends that have gotten the virus anyway. Let me assure you, just as the doctor did, the severity of this condition will be greatly lightened, less if they've had the shots and the booster shot. They might get it, but the chances of dying, as you talked about, are greatly reduced. And who, if you offered a shot for a number of diseases like cancer, diabetes, and a number of how about heart disease, wouldn't you jump into the plate if you said, I've got an 80 or 90% chance of not dying from this if you'll give me this shot?
And the long haulers, the people who are having long haulers from the first ones, they're not getting that with Omicron. It doesn't seem
let's talk
like.
about long haulers for a
Okay.
second, right? Define what you mean by long haulers, because that's a common term, but I don't think our population that's watching us really understands that
Well,
term.
and I think you guys are more qualified than I to go for that. Bill, you want to tell us what a long hauler is, or Mark?
You go.
Right. So long hauler is somebody who's had the disease and is still showing symptoms from it, right?
Let's talk about
Right.
that.
It's an important point. Let me throw some stats at you, and then you give us a local perspective on it, okay?
Because they certainly will keep the positive for a pretty good while.
Oh my gosh. So people think they've been infected, or there's been a breakthrough infection. There's another call coming in, if we can get that. And want to just get that call now, and I'll hold off on my comment.
Okay, I
Yep.
normally would do hold. Want to pick it up and hit hands-free?
Yeah.
Okay. Hello, you're on the air. Do you have a question?
Yeah, I'm a COVID survivor. My wife and I both contacted COVID at the same time. And she is still having problems from it. She's on oxygen 24 hours a day, 7 days a week.
Wow.
Because
How long ago did you have
attacks her heart, and that's been a year ago.
A year ago. That's a good segue into what I was just about to mention. I'm going to give you some, and I'll read to you some national statistics that just came out again from the CDC, and have been confirmed in Israeli studies. Survivors, as you and your wife are more than twice as likely to die from in the subsequent 12 months after a COVID infection than those who tested negative for the virus. So if you tested negative, you're half as likely to die if you've tested than if you tested negative. If you're over 65, that number
It also took 100 pounds off of me.
yeah, absolutely, and you're blessed for being healthy enough to survive it. If you're over 65, that increases to almost 4 times a greater chance of dying. And that's not dying of COVID. That's dying of heart attacks, of perceived strokes. These are deaths that are not being counted as secondary to COVID. But the stress on our other systems is so great that other natural deaths are occurring into a person who was so stressed by the disease that the chances of you dying are substantially higher. Another argument to be vaccinated. Were you guys vaccinated before your infection?
No, I was vaccinated after the infection.
What was the cause of your delay?
We got it in January last year, a year ago this month.
May I ask what your hesitancy was in getting the vaccination?
I'm not sure really what the hesitancy was. I was reeling off some other sicknesses that that I'd had over time, you know, and a doctor told me just kind of be careful, and so I just took the J&J. I took one J&J shot, and that was, I took it in February after I had COVID in January.
Have you been boosted?
Have you had a booster?
I have not. I had my another shot that the doctor told me to wait 30 days or 40 days before I had the booster. I had the shingles. My last of the shingle shot. He said wait about 30 or 40 days until I got the booster.
How about your wife? Has she had any of the vaccinations?
And I would say they're gonna probably recommend.
Yeah, she's had
or
two
the
shots and the booster.
But she's on oxygen
Damaged her lungs.
24/7.
It damaged her lungs and caused her. It was putting a taxation on her heart. She couldn't walk across the room without giving out a breath.
That's an important point. So, and thanks for bringing that up to us. It's everybody should learn from his experience. It's not an isolated experience. It's very common, and I'm sure it's filling the offices as outpatients with our wonderful pulmonology team at Nash, managing these enhanced conditions in people who once had COVID, who still test negative, but may never be normal again. You know, God forbid, but your wife may be on oxygen forever if the disease that hurt her lungs did not recover.
One of the things that we noticed with some of these ancestral strains like Delta, when they had the onset of symptoms, and let's say that was day one with the actual infection, that around the 8th or 9th day, they would either start to get better or it would go lower respiratory. And that became very serious with patients that when they went lower respiratory and noticed they were really having a difficult time breathing and wheezing when they did breathe, it was a really, really difficult time. We've seen a lot of long-term effects that are coming from these, especially those that ended up in the hospital and had lower respiratory issues. Now, he mentioned he lost 100 pounds, which is a good thing, maybe, depending on what he weighed before. But obesity has played a big high-risk factor with the Delta, with any of these coronavirus.
Anything that compromises your immune system, which includes age, we always talk about being over 60 or 65 as being a risk factor, diabetes, hypertension, and then access to health care. A big racial disparity in our community is that people of color have some institutionalized racism which prevents them from getting access to health care. It's not necessarily that black people are more sensitive to the disease or have a more compromised immune system, all else things being equal, but if a pharmacy is farther from you than it is from me, if your doctor's office and the availability of a clinic is farther away for you than it is for me, because of the wealth of your community, then that's where your health department really has to step up, and the hospital does as well by doing outreach programs.
And they have.
And they have.
Yeah, I can't wait to mention that.
Yeah.
We joined forces with Reverend Thomas Walker and his son, Councilman T.J. Walker. And we did a number of clinics. He just worked very well with Ebenezer Church. I can't say enough good things
and
about the
Greater
Walkers.
Joy. And in fact, our hospital had people go, and I think it was the health department, to people's houses even.
Yeah.
I mean, that's probably one of the only good things that's come out of this pandemic, is there are a lot of community relationships that have grown out of this. Because
and a big important day was when Reverend Walker said, I'm rolling up my sleeve. I said, let's get the newspaper for that. Let's get your congregants, look at what you're doing and have trust in what you're doing.
Right.
Absolutely.
I'll tell you another effect this stuff had on me is I went to see my primary physician after I got where I could go see him, and my A1C had jumped up to 8.
Diabetes.
Diabetes.
And
Yeah, he's diabetic.
And again, were you known to be
Ozempic.
were you known to be diabetic before?
Do what?
Were you known to be a diabetic patient before that?
I had diabetic in my family, but I was never diabetic. But now it's got down to 5. He got it back down to 5 right now.
Well, good for you, and praise to your family doctor for being so excellent. The fact that you have diabetes at all just is another challenge to your immune system, which unfortunately is a very large part of our community.
And those on chemotherapy.
Absolutely. Everybody knows, for example, a couple months ago, General Colin Powell died, and he had a cancer that compromised his immune system. And even though he was boosted, had his 3 shots, he still passed away from COVID because he could not mount an immune response. We're going to take a break now. We'll see you again in a few moments, and we're going to talk a little bit more about herd immunity and some of the other contributions that you've done for our community.
Thank you for calling.
We enjoy your show.
Thank you.
The foundation plays a really integral part in the health of our community. They help with the health system identify those needs and gaps.
As a physician here at the hospital, we utilize the foundation to offer a lot of supplemental support services that may not be covered by insurance, but are fundamental and instrumental to the health of our patients.
The foundation may be able to assist with some of the financial burden that the patients experience outside of the hospital, such as rent assistance, utilities, and some medication needs.
The inpatient food pantry. The foundation has been instrumental in raising money here, and it's meeting a critical need that many of us don't know about.
Getting them the food and the help that they need, especially from the food bank that we've implemented, has been really successful, and our staff have been really engaged and excited about being able to provide this service to the community.
Their support of our cancer center and services, the heart center, the women's center, hospice.
There's everything from getting car seats to, at the same time, we needed a new ultrasound machine, a significant contribution that makes us be able to just quickly bedside do an ultrasound. And in some cases, not too recently, I walked into the room, never met the woman, scanned her, and said, okay, we're going immediately to the operating room and you're going to have a baby. It was life-saving for her baby.
When patients are having difficulty getting home, maybe they came into the emergency department on an ambulance, and the Foundation's Patient Assistance Fund will sometimes help get them to their home.
We had a patient who had diabetes, and he needed help getting a machine to check his blood sugar levels and all of the supplies that he needed to do that. I reached out to the foundation to see if they could assist us with providing that to the patient, and they were able to do that for him.
The new community paramedic program is an outreach to help folks who are being discharged from the hospital, making sure they have what they need and are set up for home.
And the foundation allowed us to go from 1 community paramedic to 3 community paramedics.
People don't realize how many extra services people need that aren't covered by insurance or are not included as part of health care, but have such a tremendous impact on health.
And the foundation and all the positives that they do in the community, the different ways they serve and work together and serve the community. It's easy to get behind it more and more and support it.
Because we all live in the community and we all want a healthy place to live and work.
It's so important that the community continue to support the foundation, mostly because of how closely we at NASH work with the foundation. We're able to go and say, hey, this is what this patient really needs, and we're able to provide that assistance.
It's my sense of loyalty to this community and the citizens that makes me want everyone to have good health care.
And I could not agree more. I think we all have a bit of a duty to try to have good health care for everyone, and this is a way that we can do our small part to do that.
Welcome back for our third segment. We have our featured guest is Mr. Bill Hill. He holds the reins at the Nash County Health Department, Human Services Director. One of the things we started talking about was herd immunity, and I want to just take a few seconds and really people understand that we define that, because off the air we were talking about how some of the baloney things that we're being told to as board members of the hospital, as the overseers of generalized health care in the community,
Well,
and
I'm
I get
not
as
being told baloney stuff at the hospital, though. I don't want anybody to take
no,
that.
not at the hospital,
Not
but
at
as
the hospital.
but in your personal life, and
Yeah.
some of the things are like microchips, total baloney. It's political. Couldn't imagine where that brain power comes from. It's actually a stupid comment. None of the providers of or the manufacturers of these medicines are owned by the government. In fact, I own Pfizer and I own Johnson & Johnson because it's part of my IRA. We all have that if you have a retirement plan. Moderna is privately owned, and Dolly Parton's making more money off of that than anybody. So these are not government agencies at all, so it has nothing to do with the government. Would you agree with that?
I absolutely agree. Public health and politics are separate in this particular arena, and I don't understand how they become intertwined.
I had a patient tell me last week that it's a microchip that they're putting in you, and I asked them, well, how do you charge that thing at night? Because I have an electric car, and it needs to be plugged in every night, and so does my iPhone, and it's hard to imagine how a microchip is going to be getting its power supply. Things just aren't thought up. This is just a virus. It's the same type of virus that's been infecting humans for 1 billion years. And we need to deal with this intelligently. This is not politics. This is not BS stuff like microchips. It's just medicine. It's based on science. Please listen to your doctors.
And if they had lived in the 1950s, and this is early time for me too, but lived in the 50s and 60s and had the opportunity to get a polio vaccine, they stood in lines because they saw people in wheelchairs. They saw the president, Franklin Delano Roosevelt, in a wheelchair when they had that opportunity.
But younger people just don't see that.
They don't
and
see
they
that
don't see it
crippling-
because they've been vaccinated as children.
Yeah.
Right? So,
I want to follow up on something you said earlier, Bill, because I absolutely had never heard if one's had it, that's not great immunity. I mean,
Well, of course, anytime you have something, you've got some antibodies that are building up. And depending on how healthy the body is, the host is, as opposed to somebody immunocompromised, certainly you do get some protection from that.
Some.
But the vaccine-induced immunity seems to be better with this particular one. And the 2 shots do well, but when you boost it, it goes way up to 80-85%. You still see breakthroughs. We still hear about breakthroughs, but they just so much less acuity and severity involved with those particular patients.
and people are not defying their politics. I'm conservative. And boy, I couldn't wait to get it because I don't want to be a long hauler. I don't want the rest of my life, which I hope will be long, to be suffering from like this poor man's wife is on oxygen. I mean, you just hear things all the time. People didn't get their taste and smell ability back. They have horrible lung conditions. I don't want to jeopardize my quality of life going forward, and so it was a personal decision, and I don't want my family to have to take care of me.
And one really good example I heard, you mean you trust me when I get real sick to go to the hospital and treat me, but you don't trust us well enough to give you a vaccination.
Or just the fear of the vaccination. I have yet to ask a patient, if you stepped on a rusty nail and you started getting some back pain and your ER doctor said to you, I need to give you this tetanus vaccination, would you take it or you'll die? 100% of my patients have said, of course I would.
Yeah.
Right? Well, that's a living bacteria that we're giving to you, infinitely more risky than this messenger RNA vaccine, infinitely more risky.
And you need it every 10 years, whether you step on the nail, don't you?
You need it whether you step on it or not, or a pneumovox vaccination every 5 years.
That's right.
Before I let you answer this question, which will be that the health department does and has served us pre-COVID in a multifaceted way. You still run a huge department that serves the community in dozens and dozens of ways. And I want you to explain that to us in a second. First, I want to point out to people that soon in a few seconds in the bottom of the screen will be another the same website we posted before, that if you need testing, and you're asymptomatic and you just have a concern, or you're mildly symptomatic with flu-type symptoms, and because it's the flu season as well, please go to the website and look what testing center is close to you. Do not go to the emergency room. You may actually be, first, delaying your care because you're going to be there a whole lot longer, and second, you're creating an unnecessary expense because they're going to have to activate a complete workup for you, and you'll be there for half a day unnecessarily. And the most important thing is you're probably robbing attention from somebody who really needs it.
It's a poor utilization of that resource.
Very poor utilization of a critical resource. Our emergency team is wonderful. They have really severe problems they have to take care of expeditiously, and testing is not what you're supposed to go to an emergency room for. So please write that down. If you have some concerns, any concern about whether you think you have it, testing is an appropriate move. Vaccination is first, testing is second. Go get tested, but just go to the right place. Now,
If you have a reason to get tested.
If you have a reason.
As Bill, gave us examples of when you would, not just because, hey, I want to see if I've had it or if I haven't.
And I'll take this opportunity again to say we're testing tomorrow in Nashville at the Ag Center from 10 to 2, and we're vaccinating on Thursday behind the health department. All drive through, it can't be easier, and the cost couldn't be better.
It's free.
My favorite cost.
Yeah.
So tell us a little about this massive department that you've been running. It is a complete department, and you haven't stopped doing any of those things during COVID.
That's right. We have a designated team of COVID staff, and they've done a wonderful job, but that is part of the difficulty with dealing with coronavirus, is dealing with running the regular health department type services. And when we talk about that, we probably do 40% of all prenatal care. We have two different OBGYN groups, one that goes to our Rocky Mount office, Nash OB, and of course Inglewood OB with Dr. Tommy Harris coming to our Nashville office. Those deliver those babies from those respective offices. But we also have a big family planning following with patients. We have a large pediatric clinic, well baby clinic, primary care, and also do the immunizations in many instances. STDs haven't gone away. Just because we got a coronavirus or COVID-19, we still have gonorrhea and syphilis and chlamydia and those kinds of sexually transmitted diseases. Not to mention the managed care programs that we're involved with, where our folks are looking at those high-risk patients, prenatal patients, those patients just had babies, or those folks who have children that are at high risk, going to their homes, looking at them, tending to them, making sure they're following up on the nutritional benefits, doing dietary retakes, going out and following up, making sure they're making their doctor's appointments or to their health department. Environmental health is a big issue. We do all these restaurants you're eating, meat markets, delis, in the grocery stores. Our folks are still inspecting those places.
You give the 99.8 ratings to some places?
Some places. Some places. And that's an A. But when it goes into the B, we get concerned. That sign should be, the law says, in a conspicuous place. You shouldn't have to look hard to find that A, B, C. And we don't have any C's. But we certainly
Animal control, I know that's a...
Animal control is one that Nash County Health Department has that our neighboring counties would not have, being the Sheriff's Department. But we have a very strong animal control program, and I'll just mention we're in the process, already finalizing the plans for a brand new animal facility.
Super.
Right beside the vet tech program over at the community college.
Oh, good.
How about that
Location,
feeding each other? They already provide services for us, but now we're going to be kind of hand in glove with that program.
Wonderful.
We also run a solid waste program. All those 9 convenience centers, those recycling centers, that's part of the health department also. So we run the clinical part, the environmental part, and then, of course, you mentioned animal control and our solid waste components. So and we run multiple offices. Of course, we have an office downtown Rocky Mount, and we have our...
Near City Hall.
That's right across from City Hall, and our main office in our county seat in Nashville.
How about people who can't get to you?
In what particular instance? We used to have a home health program where we did go see a number of sick folks, and there are a number of private home health agencies in the area now, and that's why we got out of home health. But we do actually provide some services in the home when we need to. We use the paramedics primarily with COVID-19, the community paramedics, to deliver a number of these shots in home to these patients that could not get to them.
Bill, are you our link to DHHS? So during all of COVID, when we'd see Mandy Cohen, Dr. Cohen there speaking and telling things, do you have regular communication with the state level?
Today at 1 o'clock.
Oh, okay.
we had a statewide, a lot of times on Tuesdays, 1 o'clock, every county health department, about 83, 100 counties though, some are districts. But we have a statewide conference with, today, of course, Dr. Cohen has left, but we had Dr. Betsy Tilson, our state health director, and key people in all those different departments giving us updates on not only the new cases, but the new treatment options available, and also telling us when we can expect our new supply of vaccine and when we expect our new supply of test kits, which we desperately need. And again, hospital came to our rescue on that, and they're good neighbors, good partners, and we appreciate that.
Good.
Your leadership.
Like the hospital administration, which you were just talking about, right? And the whole management team at Nash Hospital, the ICU team and the ER team, they often don't get the recognition that they deserve in the role in healthcare. When a patient comes to me, I'm in their face. They're awake and they're oriented because they're not in an ICU getting their life trying to be saved. And so they often reflect gratitude to us. But it's unsung heroes like you, the hospital administration, the pulmonology team, the people who run our ICUs and the ER team. You're really the unsung heroes that really impact the lives of people who, and you'll never know them and they may never know you. And so thank you to all the people that I just mentioned for really saving the lives of a lot of people and positively impacting them. And you may never get that direct feedback that a primary caring physician like me may get.
In public health, I mean, you're available to the public.
And we're doing well when people are well. In other words, preventive medicine is trying to prevent a situation that could be much worse. So I think a lot of times when you go into a restaurant, what you're saying, I really appreciate the fact you didn't get sick, you didn't get salmonella, you didn't get a staph infection from eating.
Because of what you do.
But there are guards watching, and making sure those temperature controls right, making sure hands are being washed, masks, hair nets, the whole bit are taking place.
Give us 1 minute answer on this because we have to, because we're about to close. What's your best memory in your decades of dedicated service to this county?
Yeah, pardon my verbosity here, but I think this would have to go down as one of the more memorables. Obviously, we go back a number of years and look at the different ways we have evolved in public health. When I first came to Nash County, we were doing a number of x-rays. We had probably 50 some cases active tuberculosis a year, and that's been a great reduction now. I would have thought syphilis would have been down. I would have thought the sexually transmitted diseases would have been reduced to some degree. I am still surprised with the habits that we see that public health really subscribes to, whether it's smoking, whether it's poor eating habits, etc., no exercise. I am still surprised that we have a large number of people involved now. But to answer your question, I think the pandemic is going to go down as a place in my memory that public health, again, had a very viable role to play. I saw more people come to the health department in the last year that you would have never seen in a local health department if it hadn't been this pandemic and stepping up to the plate to try to deal with it. And I think public health nationwide has been involved there.
Well, you've been a leader in this community throughout COVID in a way that people don't realize. I mean, Sandra was telling us that she has seen all along, and I know the hospital Dorsey Tobias sends out your information and the pamphlets and stuff for us to be able to disseminate. But you've been our leader. I mean, you've been the Nash County standard bearer for helping us get through this.
This is a little embarrassing. I don't think I quite deserve. I don't deserve that,
But we
I have.
appreciate it.
I have tried my best. We've had over 20,000 COVID-related infections that we've recorded so far. That's the cumulative number. But we've tried our best, and it's easy to lead a public health effort when you have such a great staff, and not just mention the folks that work under us, but the leadership with our boards, with our Human Service Board, our county commissioners, and our manager, county manager. It's just been, I don't think you could work in a better county.
Good.
I'm a little
And to have
biased, though.
and to have the support of an amazing hospital within that county.
Absolutely.
Yeah.
And the doctors.
Yeah.
I mean, the doctors have been just a tremendous asset when we make referrals to them.
This brings this show to a close. I would like to point out that February is Heart Month, and our next show will include a phenomenal cardiology team leader, Dr. Prasada. Following that, we have a super exciting guest, the gentleman who's held the reins in changing our hospital to a world-class institution, Dr. Lee Isley. He's the CEO of the hospital. We're super excited to have him on
February 1st.
February 1st.
And Dr. Prasad is the 25th of January, so don't miss him. People love Dr. Prasad.
By the way, in these closing moments, if you could put that site up again for people can find where to go for local testing. And at the very end, I'm going to have my email up there. If anybody has any questions about the safety factors, about vaccines in the future, please email me personally, and I will answer your questions personally. And then contact that website for testing. Do not go to the emergency room for inappropriate testing or for appropriate testing. Go to that website, find out where to go, and then go to that location. And thank you for joining us again. We'll see you soon for the next edition of Call the Doctor.
Thank you.